of them have diseases such as HIV, dengue, and heart problems, and in most cases, mild fever and colds. But only some of them have access to healthcare services and medicines in the country. The more privileged people are lucky enough to buy highly priced medicine and afford to go to private facilities which have greater amount of medical supply. This builds a greater gap between the lower classmen and the upperclassmen of the society.
A survey conducted by the World Health Organization in 2009 concluded that the cost of medicines per month for mild ailments in the Philippines was averaged to be 485 pesos, while chronic diseases being 946 pesos. This may be due to a number of problems such as the shortage of drugs in government hospitals, which forces patients to pay out of their own pockets in private pharmacies, and the fact that most drug ingredients used here are imported or outsourced, therefore increasing in value, not to mention added taxes and price markups. These high costs discourage financially struggling Filipinos from getting the treatment they need to live a healthy life, which should never even be a choice but a necessity.
Based on the National Statistical Coordination Board, the average income of the upper class is 200,000 per month, while a middle class family earns an average of 40,000, and the lower class earn an average of 10,000 per month. Considering the amount of each family needs every month for electricity, food, and other expenses, only a small amount of cash will be left for medical needs for those family earning low income.
A study done by the World Health Organization showed that the Philippines is one of the top countries where less than 30% of its population has regular access to essential drugs. This is due to the high prices of these essential drugs and the low income the common Filipino family gets. Without the affordability for Filipinos, they find it unreasonable to buy medicines unless they are truly dying and or mainly rely on at-home remedies. From my own experience living in the United States, medicine is very easy to obtain with insurance and is also very affordable for those in need. Unlike the Philippines, the US provides affordable insurance, and there are even plans for low-income families to get their hands on these essential drugs.
According to Health Sec Polinobial, the Philippine government will start to pay the hospital bills and the medicine of the poor Filipino people in 2017. 96.366 billion peso of the national budget will be allotted in the DOH or the Department of Health in 2017. In addition to that, poor patients will no longer be charged by the government hospitals.
Health Secretary Pauline Obial, the Duterte administration will focus on the universal insurance coverage and lowering drug prices by making essential drugs and maintenance drugs available to the poorest Filipinos. They also want to ensure that all health facilities in the country will provide the care and services they need to Filipinos and to whatever level of care they need.
So, as an industrial pharmacist, what is your opinion about people from the higher class who are able to afford more healthcare drugs than those in the lower class?
In my opinion, Filipinos suffer from healthcare access. So when I say healthcare access, it means not only medicine, but of course the facilities and the services of the government. Especially the poorest of the poor are the ones suffering from this benefit of the Filipino. So I believe that the government should do something about it to be able to reach the poorest of the poor by partnering with the industry. So they will be able to help the Filipinos. Affordable medicine is one, but of course of good quality, and then hospitals that are subsidized by the government, and the services. I think doctors should be more visible in the rural areas. I think that's it.
Thank you.
So
So since lower class people have the tendency to buy the lesser priced medicines due to financial capabilities, do you think the generic medicines are as same as branded medicines when it comes to efficacy?
As I encounter different patients in my practice as a community pharmacist, I consider financial capabilities of patient in terms of buying prescribed medicine. Mostly, physicians prescribe generic medicine as a standard practice here in our country. As a pharmacist, I can say that the efficacy of branded and generic medicine are the same, formulation of which contains the same active ingredients and components to give the desired therapeutic effect. Prices vary only in terms of where the said medicine is manufactured. Branded medicine and in reality are more expensive because most of it are from international manufacturers, while generic medicine are lesser in price because some are totally manufactured but approved and registered under the Food and Drug Administration. All medicines, either branded or generic, which are registered under the FDA, are said to be efficient in treating diseases here in our country. Thank you.
Thank you.
Aside from the current plans of the government to allocate a national budget to the Department of Health and to reduce the cost of medicine as well as to ensure that the poor are provided with proper care and services, it is suggested that the quality be kept in control and that the drug manufacturers will be monitored more seriously. It is important that the prescribing and dispensing of prescription drugs are maintained in good quality for the medicine to take a progressive effect on the patient.
The Department of Health had already implemented a ceiling price for drug manufacturers and companies to control overpricing of their products. Despite this, medicine remains difficult to be attained by those less fortunate Filipinos, especially during nationwide epidemics. In these times, prevention could be a possible solution. If programs are set to provide healthcare for those struggling in times of epidemics, we could lessen the risk of infection to others and minimize the spreading of the disease, causing less people to need and purchase medicine they are already struggling to afford.
Another possible solution to this issue is to inform the people on the importance of generic drugs. Generic drugs have the same therapeutic effect as their branded counterparts, yet are typically sold at substantially lower costs. This would allow those in the lower classes to save when it comes to buying medicines. Thus, they would be able to afford any other future medications that would be needed. Despite all of this, proper diagnosis should not be overlooked. This is because it is essential for people to buy only the medicines and drugs that are necessary and needed for their certain condition in order for them to save money for their future expenses.